Hello, everyone. Today we have with us one of the eminent doctors from Gurugram, Dr. Rajiv Yadav. Dr. Rajiv Yadav is chairperson, urology and head consultant, urologic oncologist and robotic surgeon in Artemis Hospital, Gurugram, Delhi. Dr. Rajiv Yadav has rich experience of 21 years in the field of urology and oncology and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very warm welcome to you, sir, on this platform. Over to you, sir.
Thank you. Well, I am Rajiv Yadav. I head the Department of Urology at Artemis Hospital, Gurugram. I also head the Urologic Oncology program, and I'm head of the Robotic Surgery program at Artemis Hospital. I perform surgeries for urological cancer, which include prostate cancer, kidney cancer, and urinary bladder cancer, to name a few of the cancers which involve the urinary tract.
So, sir, we'll begin. As you know, we are going to be discussing prostate cancer today. So, we'll begin with our first question. So, sir, we all know that prostate is a small walnut-shaped gland in males. So, can you please tell us something about what is prostate cancer?
So, as you rightly said, prostate is a normal organ in every male. It's a very small gland which is at the outlet of the bladder, and the urine actually passes through it. The role of prostate in any man is to provide the semen as a part of the reproductive system. Now, with age, certain changes happen in prostate also, as in any other organ in the body. And one of the issues which we see quite commonly is prostate cancer. Now, as the name cancer suggests, cancer is simply an unregulated growth of the cells. So when a cancer happens in the prostate, it can lead to various issues depending upon what is the stage of the cancer, what is the size of the cancer. It may lead to some urinary issues. It can lead to blood in urine, some problems like urgency, increased frequency of urination, slowing of the stream. So these are the symptoms which may be seen in early situations. And unfortunately, in some men, by the time they present to us, if the disease or the cancer has spread to other parts of the body, then it can lead to other issues related to where the cancer has spread. It can be like bone pain or generalized weakness, etc.
So, what are the chances of Indian men getting prostate cancer?
Well, unfortunately, we do not have a very robust data from India where we can exactly tell you about what is the exact incidence of prostate cancer in India. So we can roughly have an idea based upon some of the database which is kept in metro cities in India. What we can say is the second most common cancer in men after the oral cancer or the mouth cancer. If we want to get some idea, it is known that close to 1 in 8 men will suffer from prostate cancer at some point of their lifetime. This data usually comes from Western countries, but based upon our experience, we don't think that we are any far behind from the Western countries in terms of the risk of prostate cancer in our men.
So, sir, are there any specific risk factors in some men which make them more prone to develop prostate cancer than others?
Well, the biggest risk factor for prostate cancer or developing prostate cancer is the age. With advancing age, all men are at risk. We see that the risk of prostate cancer is more as the age advances after 50 or 60 years of age. As the age further advances, because the lifespan is now improving, in 70s and 80s, quite a good number of men may have prostate cancer. Some of them may be troubled by it, and some of them may not have any symptoms at all. But the incidence increases with age. Other than that, some of other modifiable risk factors. I mean, you cannot change your age, but there are certain modifiable age risk factors, which includes obesity, people taking more amount of animal protein, processed carbohydrates or processed food can increase the risk. So these are some of the, and of course, one of the risk factor is people having a strong family history of prostate cancer are also at a much higher risk compared to general population. So any person who has a strong family history in terms of the prostate cancer happening in their brothers or father, those are the patients who are at higher risk of developing prostate cancer, and those are the people who should undergo extra effort in terms of screening and regular checkups.
Sir, it is said that frequently urge to urinate is one of the earliest diagnostic symptoms. Is it true?
Well, regarding prostate cancer, the symptom of frequent urination may not always pinpoint that the person has prostate cancer. It simply means that the prostate enlargement is there. Now,
Right.
prostate enlargement is quite commonly seen otherwise, even in the absence of prostate cancer.
Like in BPH,
So,
also the same symptom
right,
might be there.
yeah.
Okay.
So just increased frequency of urination may not always mean that someone has prostate cancer, but this is the symptom which will indicate that the person should seek medical advice. And many of these people who have presented to the urologist with these symptoms, on investigation, we may find that they have early prostate cancer and treatable prostate cancer. So people having symptoms are advised to at least seek a consultation from the urologist. And if, God forbid, they have prostate cancer, it will be detected early enough
At
to
an
be
early
treated.
stage. So, sir, what other symptoms should they be aware of?
Well, any urinary symptom in terms of with advancing age, we see that people may take more than usual time to pass urine, meaning slowing of stream, increased frequency of urination, getting up more frequently at night, feeling of urgency, it means sudden uncontrollable desire to pass urine. Uh, so these are some of the early signs and symptoms. Rarely people may also have blood in urine, but that is not a common sign.
So, we've all heard about the PSA test as one of the most common diagnostic tests for prostate cancer. So, if you could tell us something about this particular test.
So PSA is a very simple blood test which is carried out as a diagnostic modality for prostate cancer. It basically means prostate specific antigen, as the name signifies. PSA is prostate specific antigen. It is a kind of a protein which is released from the prostate gland into the blood. And based upon the level of PSA, the urologist will be able to justify whether he needs you to carry out some further investigation. And many of the prostate cancer can be detected in early stages where these patients are treatable with this simple blood test.
So, sir, further to this, what other investigations or radiological investigations need to be carried out for the diagnosis of this cancer?
So, whenever a urologist will suspect someone having prostate cancer, based upon the suspicion level, they will advise investigation. Simply to start with, we begin with PSA, the blood test, a
Right.
urine examination to rule out any active infection. If the suspicion level after this blood test and physical examination is there, then we usually suggest to carry out an MRI of the prostate. Now, MRI is one of the radiological investigation which gives us a lot of information about the possibility of prostate cancer and the area of the prostate which might be involved by the prostate cancer. And it helps us in guiding the biopsy, which is done as a confirmatory test to diagnose prostate cancer. So in the early stages, MRI is one of the investigation. And once we have diagnosed someone as prostate cancer patient, we might advise them to take a PSM, a PET scan, which is part of a staging investigation to find out what is the stage of the tumor.
So, do we have surgery as the major option for treatment, or do we have chemotherapy and radiation therapy options also?
So the treatment part of prostate cancer patient will depend upon what
Stage the patient is.
the patient has come with, I mean, the stage of the cancer. And then there are various other factors which are important in deciding what kind of treatment is suitable for the patient. For example, the treatment modality, which basically are surgery, radiotherapy, hormonal treatment, and chemotherapy, these are broadly the treatment modality which is used in prostate cancer patients. Now, which treatment is suitable for which patient and which particular situation is dependent upon many factors. One of them is the stage of the cancer. Second is age of the patient. What is the performance status? Means how fit the patient is, whether he is fit enough to undergo surgery or not. What is the life expectancy of the patient? Meaning thereby, if we try to treat their disease or cure the disease, what is the average lifespan of the patient, keeping in mind other conditions like heart condition, diabetes, which are quite common at this age. So these are the factors which will help us in deciding. Now, nowadays, the treatment is kind of a multi-modality treatment where we are not just dependent upon one kind of treatment option. We may choose to suggest a combination of treatment options, meaning thereby we may add surgery with radiotherapy or surgery with hormonal treatment and radiotherapy in
So all
various
kind of
sequences.
permutations and combinations can be done. So please go on. You were telling us something else.
Yeah, so depending upon the patient's situation, the urologist or uro-oncologist who specialize in prostate cancer treatment, they will guide a particular patient, and depending upon the situation, some of the patients are considered suitable for surgery. We offer them robotic surgery. If the patient condition is not suitable for surgery, they may be considered for radical radiotherapy. If the disease is quite advanced, meaning it has gone to multiple organs beyond the prostate, then surgery and radiotherapy may not be a good option for them. Then we consider hormonal treatment and, in some situations, chemotherapy for the treatment of these patients.
So you just told us about robotic surgery. So in India, which centers are doing robotic surgery?
Quite many of them.
Okay.
Robotic surgery is there. I think in India it started in 2007, and since then there are so many centers in India which are offering robotic surgery. In Delhi itself, you will find probably 8 to 10 centers who offer robotic surgery. So it's not just the institutions which offer robotic surgery; it's the whether they have a proper team in place or not. So that is
Right.
what is more important. Robotic surgery is kind of a team play. It is not dependent upon one person or
One
one
person.
machine. Yeah, it's not just a role of a machine, but it's the role of the complete team. So any center which has a team of people and experts, uh, they can provide a good treatment for prostate cancer.
So sir, post-surgery or post-treatment, what are the chances of survival in these patients?
But prostate cancer is one of the cancer which has an excellent survival after treatment. It all depends upon what stage the patient presented to the doctor. In very early situations where the patient has a localized disease, the treatment may cure him of prostate cancer. And the curative treatment in those situations could be surgery or radiotherapy or a combination of these two. So in this situation, more than 95% people will be surviving for 10 years. Um, in some situations where the patient has presented or they got the diagnosis quite late, the disease has spread to multiple organs, including bones and lymph nodes. Their cure is unfortunately not possible at this point of time. Maybe the future research will guide us through in that direction. But we have treatments which can control the disease for quite a long time. And these patients also have a survival of at least 5 to 6 years with all the treatment options available to us.
So sir, during this time of the pandemic, do you want to give any particular suggestions or recommendations for these kind of patients?
Well, in our experience, the pandemic has thrown a lot of challenges in terms of evaluating the patient properly. Although we have increased our availability to the patients through video calls and tele consultations, but it still is not able to fill all the gaps. We are not able to examine the patient, and the information doesn't flow that easily and completely. But still, I would suggest if the patient has any symptom which may lead to the diagnosis of possible cancer or any urinary symptom for that matter, they should consult their doctor, even if they are able to consult them through video consult or teleconsult. At least the doctor will be able to find out and suggest which patient need further evaluation, and with the next available opportunity they can always undergo the test and the disease can be diagnosed in early situation. I would simply suggest that do not ignore the symptoms. Resources are available, and the help even through video consultations can help us in diagnosing the cases early enough and avoiding the situations where the disease comes in advanced situation.
That's it from my side, sir. And I really thank you for the valuable time that you have given to us and the insight into this particular disease. And I'm very sure our audience would this was a very informative session and they will gain a lot of knowledge from this, sir. Thanks once again for being on this platform, sir.
Thank you very much. Thank you for this opportunity.
Thank you, sir.